Hey guys, it's Miss T Lovely. I'm coming at you to update my video and answer some common questions asked about what you need for real-life band surgery and the ins and outs about surgery and what the process is like. I get these questions a lot and I wanted to go ahead and answer them all here. So first question is, how do I stop drinking water before and after meals? Well, for me, it came naturally. You know, I just know that they say that if you drink water, it washes the food away with the band, because the purpose of the band is to keep you full for a longer period of time. Whereas if you drink water before the 30-minute time interval, it will wash the food away. That is what's said. Some people differ in their opinion, but this is what the most books say. So you're supposed to stop drinking. I stop drinking my water right before I eat. Just right before. Like, I'll drink up to the time I eat, and then I'll not drink for 30 minutes. This might, it seems harder than what it really is. It's really not that difficult, guys, just to not drink water after you eat for 30 minutes. How you can practice it is, don't bring liquids to the table when you sit down to eat. Simply let your, eat your food and grab a book or get on the computer or do whatever you're doing for those 30 minutes. 30 minutes actually flies by pretty quick. Now, some doctors and some people will even say that they wait an hour. For me, it's 30 minutes. Another question I asked is, what's it like after surgery? What's the pain like? Is it so bad? No, it's not supposed to be. As a lot of you guys know, I had a bad experience with being allergic to morphine. So that's the only reason why I had severe pain and blood pressure dropped. My life was actually in danger because of this incident. But that's further back in my videos. But otherwise, you're only supposed to have some gas, a little bit of gas, and what will alleviate that is you walking around a lot. They will have you walk around your floor a few times. And as you walk, you'll find that the gas pains begin to alleviate. But if you have worse pains than that, there's a problem. Notify the nurse or somebody, make them listen to you, because I find that with the whole process, even with the process of approval, you will find that people don't do their jobs. I don't know what it is. It's like they send out a mass email, let's not get this person approved, let's make their process longer than what it has to be. Because, even I dealt with, having to make sure the insurance company is pushing the papers and the approval, making sure the other people on their end is getting it, and the people who are doing the surgery, all that. You have to stay on top of people. So that's another thing. As far as what you need for surgery, I'll update. If I can think of any other questions, I'll definitely pop it on in here, or even put them in the description box. But what supplements should you have on hand straight out of surgery? Now, don't worry about, especially the first couple days, please don't worry about drinking all the water in the world and getting all your protein in, because you will be sore for the first couple days. Your focus more than likely will be liquids, depending on what surgery you've had. If you've had lap band, it will probably be 3 days to a week, maybe more for some people. For gastric, you might have 2 weeks, and it may differ. Like I said, everybody's doctors, surgeons are different, and these are the things that I've gotten and I remember according to my knowledge and my research and the information given to me. So this is what you're going to need. You're going to need a good calcium supplement with vitamin D. So I take Bariatric. It's calcium with 500 IU of vitamin D. There's 100 soft cheese. I do 2 of these a day, 2 to 3 of these a day. You're going to need a fiber supplement. I use the fiber gummies. I have these from CVS. These are like my backups to my, these are my backups to my other ones that I have here. You can simply buy them. Now, these are chewable. Chewable ones are known to be more dissolvable. And, I could have easily switched over to pills, because I can now swallow pills being 40 plus weeks out, but I prefer the chewable ones because they seem to the body seems to take to them better after surgery. You know, especially for people that suffer from malabsorption, the body's able to absorb the gummy better than the chalky, you know, tablets. You're also going to need a good multivitamin. Now, bariatricadvantage.com is a good site, you know, for bariatric surgery, and that's the best supplement you will ever get. That's my opinion. But if you can't, these are good as well. I use these Your Life multivitamins by Nature's Bounty. They're really, really good. I just take 2 a day. I also take biotin. You don't want to lose any of your hair. You don't want to lose any of your hair, so I take 1,000 micrograms of biotin a day. Okay, you're going to need a subbilingual supplement. This is from bariatricadvantage.com, but I got it off of Amazon, and I only paid $8 for it, and you only need one every week. So I take it every Monday. This lasts me about a month. You're going to need a good digestive aid because you may suffer from blockage. I'm telling you right now, Gas X does not work. A lot of people suffer from constipation. I didn't have that problem out of surgery. But a suggestion is psyllium husk. I just started those, and a word to the wise: be careful with your doses on that. They suggest 1 tablespoon. But you want to work your way up to that, so you want to try to do a teaspoon. They're called psyllium husk. Okay, but I prefer to use tropical papaya enzymes. They break down your food just as well, and they're just as helpful, because like I said, I haven't had any problems out of surgery myself. And I also took it upon myself to buy a B complex. This is great for energy, overall energy. I take it every day, 2 a day. I also personally suggest drinking peppermint tea. That's going to help soothe and deal with the soreness that you're going to have after surgery. You guys, don't be afraid. You know, I remember how I felt. I had so many worries and I had so many questions, and there was no one there to answer the questions for me. That's why I went and I found the answers myself. And you know, any questions you guys have, feel free to leave them below. I hope this video has been a help. I think I answered all the questions. Also too, when you go to the hospital, it's good to have 2 people, just in case something should happen. You know, you need somebody there to help you, and you need people to be able to kind of change shifts, so to speak, because when I was in the hospital, my husband had to do it all by himself, and you know, the poor guy, because I was in so much pain, you know, because of what happened to me with the medication. If you're interested in that, what happened, and you haven't seen my video and you're new to me, I will put a link here. You can check it out. Oh yeah, when you come home, make sure you have a firm pillow to help you up and down, you know, for a little while, until that, you know, if you have some soreness, until that subsides. I hope this video was helpful, and I hope it answers some of you pre-opers questions. If you have any more questions, feel free to leave them in my personal inbox, or leave them in the description box below, and I will talk to you all later. Love you.